Can you share your personal connection to the plasma community and how your wife's experience shaped your involvement with Alpha One Europe?
Mhm. Yeah, it was after the diagnosis where we were completely helpless because her doctor could not explain what it means, and we were looking for advice how to handle this disease, and it was the Alpha One German Association that had us. The president, Marion Wilkins, perhaps you know her name, gave us good personal advice, and they have a very interesting internet site where you can find all the information that you need, but you must first find their internet site. Yes, and mm, my wife is not yet on augmentation therapy because her lung is still good enough, so she does not fulfill the requirement. But we know that there's only one direction in this disease. It will always get worse, it will not get better. And it's good to know that when uh, her lung function has decreased so much that she then will get the therapy that will at least slow down the progression of the lung decline.
How is she doing today?
She's doing fine today, quite fine today, because we have learned a little bit on how to handle this disease. The problem is that um, from time to time, so-called exacerbations do occur. That means the conditions become dramatically worse. Lung infection or bronchiectasis does occur, and then in those periods of these infections, there the patients are doing very bad. My wife did very. She had been hospitalized twice, and twice in a critical stage. But now we better know how to handle it. We see the signs coming up when the cough becomes more severe. Then we can intervene very soon because we have the antibiotics with us, and so in the meantime, we have learned a little bit better how to handle the problems, and uh, yeah, happily enough, she has not been hospitalized for the last 3 or 4 years.
Which is a wonderful outcome, but also speaks to how important education and awareness is. If
Sure,
people don't know, they don't know how to manage the disorder.
sure. And this is what you learn in these communities, and therefore, this is what we learned, and therefore I thought we should give something back. I'm retired now, so I have a little bit time. I have one or the other talent that can help in those organizations, and that's why we joined it.
That's wonderful.
Yeah.
When someone is diagnosed with a rare disease, there are a circle of people around them who also have to learn about what this means, how life-changing it is. What has your journey been like as a caregiver and as a husband?
Yeah. Uh, at first, those times when my wife was in hospital was quite hard. The disease had a life-threatening form, so you uh, hope the best, but you cannot be sure that the outcome is good. And yeah, good enough. Those two episodes went quite well, and since that we are very cautious that she does not catch a lung infection.
Yes.
That means we avoid things that we had a lot of fun earlier with. We do not go to concerts anymore, also because she's coughing. People don't like it if there's somebody in the concert that is coughing. We avoid crowded rooms, and the most severe restriction is if we want to see our grandchildren, they may not have an infection because otherwise the risk that my wife infects herself is too large. This is at the moment the most severe restriction that we have.
I can imagine, especially for grandparents.
Yes, it is. Yeah.
Earlier, before we started this interview, we were talking about the disparity in plasma-derived therapies being available in some countries and not
Mhm.
others. What do you hope to see changed in the future when it comes to access to plasma-derived therapies for alpha-1?
Yeah, this is one of our goals of the Alpha One Europe Alliance to make the therapy available all over Europe. But it is a very difficult and long-lasting work, and we will most certainly not be successful in each and every country, but we will at least try by collecting arguments, preparing those patient organizations in those countries to have a good position in the discussion
Yeah.
with those that perhaps pay and with the regulators. But so far, um, it seems to be very hard. Those that succeeded uh, have had a long journey, I know about, and yeah, hopefully we will have one or the other successful journey as well.